From pain to peril, the startling reality of untreated ulcers. Ulcers are common medical conditions characterized by open sores or lesions that develop on the skin or mucous membranes. They can occur in various parts of the body, including the stomach, small intestine, and mouth. In this article, we will provide a detailed overview of different types of ulcers, their causes, and effective strategies for healing and managing them. Types of ulcers. A. Peptic ulcers. These are the most common type of ulcers and primarily affect the stomach and the upper portion of the small intestine, duodenum. B. Mouth ulcers, canker sores. These ulcers develop on the mucous membranes inside the mouth, including the inner cheeks, gums, tongue, and lips. C. Venous ulcers. Venous ulcers occur as a result of poor blood circulation in the legs, often due to conditions like varicose veins or deep vein thrombosis. D. Arterial ulcers. Arterial ulcers typically form on the feet or lower legs due to inadequate blood supply caused by arterial blockages or conditions like peripheral artery disease. E. Pressure ulcers, also known as bed sores. Pressure ulcers form due to prolonged pressure on specific areas of the body, such as the hips, buttocks, heels, or elbows. Causes of ulcers. A. Helicobacter pylori, H. pylori, infection. This bacterium is the primary cause of peptic ulcers. It can weaken the protective lining of the stomach and small intestine, leading to ulcer formation. B. Nonsteroidal anti-inflammatory drugs, NSAIDs. Prolonged use of medications like aspirin, ibuprofen, or naproxen can irritate the stomach lining and contribute to the development of ulcers. C. Excessive stomach acid production. Increased production of stomach acid, a condition known as hyperacidity, can erode the protective lining and lead to ulceration. D. Lifestyle factors. Unhealthy habits such as smoking, excessive alcohol consumption, and poor diet can increase the risk of developing ulcers. E. Stress. While stress alone does not cause ulcers, it can aggravate existing ulcers and delay the healing process. Symptoms of ulcers. A. Peptic ulcers. Burning or gnawing pain in the upper abdomen, typically between meals or at night. Nausea and vomiting. Feeling of fullness or bloating. Loss of appetite and unintended weight loss. Black, tarry stools, a sign of gastrointestinal bleeding. B. Mouth ulcers, canker sores. Small, round or oval sores with a white or yellowish-gray center and a red border. Pain or discomfort while eating, drinking, or speaking. Tingling or burning sensation before the sore develops. C. Venous and arterial ulcers. Pain or aching in the affected area, often worsened by standing or walking. Open sores with irregular edges and a yellowish or brownish base. Swelling, redness, or inflammation around the ulcer. D. Pressure ulcers. Red or discolored skin, often over bony areas. Pain or tenderness in the affected area. Open wound or blister formation. Treatment and healing strategies for ulcers. A. Medications. Proton pump inhibitors, PPIs, and histamine 2, H2, blockers. These medications reduce stomach acid production and promote healing of peptic ulcers. Antibiotics. If an H. pylori infection is present, a combination of antibiotics is prescribed to eradicate the bacteria. Topical analgesics or gels. These can provide relief and promote healing for mouth ulcers. Compression therapy. For venous or arterial ulcers, compression stockings or bandages help improve blood flow and support wound healing. B. Lifestyle modifications. Dietary changes. Avoid spicy, acidic, or irritant foods that can exacerbate ulcer symptoms. Instead, opt for a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Stress management. Employ stress-reducing techniques such as exercise, meditation, or counseling to alleviate stress and aid in ulcer healing. Smoking cessation. Quitting smoking is crucial, as smoking hinders ulcer healing and increases the risk of complications. Alcohol moderation. Limit alcohol consumption, as excessive intake can irritate the stomach lining and impede healing. C. Wound care. Proper wound cleaning and dressing changes are essential for venous, arterial, and pressure ulcers. Maintaining a clean and moist wound environment promotes healing and reduces the risk of infection. Prevention of ulcers. A. Hygiene and infection control. Regularly wash hands to prevent the spread of H. pylori bacteria and other infectious agents. B. Safe medication use. Follow recommended dosages and consult a healthcare professional before long-term use of NSAIDs or aspirin. C. Healthy lifestyle choices. Adopt a balanced diet, exercise regularly, manage stress, quit smoking, and moderate alcohol consumption to reduce the risk of developing ulcers. Complications of ulcers. A. Bleeding. Ulcers can cause bleeding, which may manifest as vomiting blood, hematemesis, or passing dark. Hairy stools, melena. Severe bleeding can be life-threatening and requires immediate medical attention. B. Perforation. In some cases, ulcers can penetrate through the wall of the stomach or intestines, leading to a perforation. This is a medical emergency and requires immediate surgical intervention. C. Obstruction. Ulcers located in the digestive tract can cause blockages, preventing the normal flow of food or fluids. This can result in symptoms such as severe abdominal pain, bloating, vomiting, and difficulty swallowing. Diagnostic procedures for ulcers. A. Endoscopy. This procedure involves inserting a thin, flexible tube with a camera, endoscope, into the digestive tract to visualize and assess the ulcers. B. Biopsy. During an endoscopy, small tissue samples may be taken from the ulcers to test for the presence of H. pylori or other underlying conditions. C. Upper gastrointestinal series, also known as a barium swallow. This test involves drinking a contrast material that helps visualize the digestive tract on X-rays, allowing for the identification of ulcers. D. Blood and stool tests. These tests may be conducted to detect the presence of H. pylori infection, anemia, from bleeding ulcers, or other abnormalities. Factors that can aggravate ulcer symptoms. A. Certain foods and beverages, spicy foods, acidic foods, for example, citrus fruits, tomatoes, caffeine, alcohol, and carbonated drinks can worsen ulcer symptoms for some individuals. It is important to identify and avoid triggers that exacerbate symptoms. B. Stress. While stress does not directly cause ulcers, it can worsen symptoms and delay healing. Implementing stress management techniques, such as relaxation exercises, therapy, or engaging in enjoyable activities, can help reduce the impact of stress on ulcer symptoms. C. Nonsteroidal anti-inflammatory drugs, NSAIDs. Long-term use of NSAIDs, such as ibuprofen or naproxen, can increase the risk of developing ulcers and worsen existing ulcers. If possible, alternative pain management options should be explored. Surgical treatment for ulcers. In some cases, ulcers that do not respond to medications or have complications may require surgical intervention. Surgical options may include: A. Vagotomy. This procedure involves cutting the vagus nerve to reduce stomach acid production and decrease acid-related complications. B. Antrectomy. A portion of the stomach, known as the antrum, is surgically removed to reduce acid secretion and control ulcers. C. Gastrectomy. In severe cases, a partial or complete removal of the stomach may be necessary.